should we be talking about? So, why should we be talking about menstruation today? Because menstruation is a normal biological phenomenon which occurs in a certain age group for women, starting or during the onset of puberty, and it ceases when a woman attains menopause. And unfortunately, whether it is in the United States, in Nigeria, Ghana, parts of Africa, India, other parts of Asia, Latin America, there is so much of a social stigma. So first of all, I would like to thank you so much, Cfine, for having this very important and timely discussion on menstrual health and management of menstrual hygiene, especially because in less than 2 months, we have the Commission on the Status of Women. And, what I would like to say is this is something we all need to be a part of. So you can see my slide up. So what is menstrual health? Very briefly, it refers to the rights, the health and well-being, empowerment, equality, gender equity, and education of all menstruating women, and also the factors of healthy menstruation. So what are these factors? First of all, the woman should not be stigmatized. It is a normal phenomenon. It is not dirty, because a lot of women are kept away when they get their period. And I can give you an example. In India and even in some parts of Nepal, there are what are called menstruation huts, where women are locked away in these huts when they have their period, because they're considered unclean. They cannot come in and interact with the other members of the society or of their family. A lot of time girls cannot go to school. We'll talk about that later, why we all know that. And also the other issue is it's a question of violation of her human rights, because why should everybody know that a girl is having her period or a woman is having her period and she has done something, she needs to be ashamed of her getting a period because it is abnormal. So as I have said in my slide, there is not only discrimination but disenfranchisement, because when you lock up a woman or a girl in a room or somewhere separately from the house, that means she is disenfranchised because she has her period, and it is a normal biologic phenomenon. That being said, now I really like this slide, which was by the which I have put here, because what is menstrual health and hygiene? You need to have freedom of movement. Now, how can a woman or a girl have freedom of movement? Only when she has the protection and the privacy that the whole world does not know she is having her period. So she needs to have access to safe and affordable menstrual products. That is an integral part of hygiene. And I would like to share something is, I think we all remember in 2019, before the start of the COVID pandemic, in November was the ICPD plus 25, which was held in Kenya. I had the opportunity of attending this conference along with my daughter. And one of the things I would really like to say is a few days before the start of this global conference, a young girl in Kenya committed suicide. Why? Because of period shaming. So she went to school, she had her period, she stained her dress. And it is so sad that she was humiliated, insulted, and berated by her school teacher in front of her classmates. This girl left the classroom, she went back home. By the time her mother came back, she had gone to fetch water and do some work. This child had killed herself. So to me, this is horrible. I can never forget this, because this is a true story. It is a true account. It happened just before the ICPD. We talk about space. We have all the rich billionaires who went on space trips. People have gone to the moon so many years ago. Now they may be going to other planets. But to me, I don't think we can advance as a global society when a poor girl, for no fault of hers, she had her period. Instead of being, asked if somebody could provide her with a fresh set of clothes or access to safe menstrual products, she committed suicide because she was berated. So this is a major issue. So coming on, if there is no proper menstrual health and hygiene, girls cannot go to school. I'll talk more about that as I have some more slides about that. And also, they need to have the access and awareness of that the menstrual products are available. And this is another important issue. This is a multi-stakeholder partnership. It just cannot be dependent on the girl's mother, her sister, her aunt, extended family and friends. All of us in the society have an equal responsibility to make sure that menstrual health and hygiene is there for every girl, not somebody who's born into a rich family, but irrespective of the socio-economic determinants of health, it is very essential that everybody has equal access because it's a human rights issue, it's a dignity issue. Coming on, moving forward. So what is menstrual health management? So menstrual hygiene management or menstrual health management, it refers to the process of living with menstruation. With good practices of MHM, adolescent girls can attend school. And without that, they struggle to attend school because if there are no bathrooms, how can a girl attend school during her period? So the most important thing is to get to the communities. Even today in 2022, we have so many myths and stigmas. And let me tell you, even in the United States, there is period poverty, ladies, gentlemen, and esteemed attendees. So it is just not one country. This is a universal problem. The lack of menstrual hygiene management is a universal problem. It is a pandemic. And we need to have wash facilities. There need to be sanitary products. And let me tell you something, the disposal of the soiled materials is equally important because you cannot have landfills being polluted by this. And, the girl or the woman needs to have privacy where to throw away her sanitary pad. So this is something we all should be thinking about because it is also a social issue. So this, I really like this diagram. That's why I put it up, because it very clearly shows us how we all have to be involved. It is a individual knowledge, the social environment, and also it is very important. When I was a practicing gynecologist, I used to counsel young girls about period management because this is so important to tell them it's normal, it's nothing to be ashamed of. And why did you may wonder, why am I so, concerned about women's health and girls' health? Because when I was, the two very quick, true anecdotes which I want to share with you, which really shaped my life. My late mother, God bless her, who passed away 3 years ago, at the age of 84, was a French professor. And when we were in India growing up, she used a lot of these domestic helpers. I don't like to use the term servants because I find that very derogatory. Domestic helpers, many girls, you wanted to work for my mother. So one day I asked one of the girls, I said, why there are so many people who want to work for my mother? And, already my mother had like 4 domestic help in the house. So they said, because your mother is very kind and she gives us sanitary products. So I said, huh? I didn't understand, because when I started my period, my sister started her period, my mother would make sure we had the necessary menstrual hygiene products. These young girls did not. And when my mother used to go, she used to buy for the girls working in our house too. That is when, at the age of 14, I understood the lack of inequity and how economic determinants and social determinants make such a difference. this is the first thing I wanted to share. So that's why it's such a personal issue for me, that we all need to work together to address this. The other issue I have found is that, there is no proper disposal. So this is another issue which we really have to be focusing on, or how can we dispose these. And that is why it comes to the social environment. And a couple of years ago, there was a major earthquake in Nepal, and we had the menstrual cups from my NGO, American Medical Women's Association, which my colleague, the executive director of AMWA, said, Minnie, let us send these cups. So then I said, yes, Eliza, if we send the cups, these women do not have access to water. How can they wash these menstrual cups? We will be doing them a disfavor if we send them cups where they cannot wash and they keep using them. It will lead to further challenges, and may cause infections. So again, the social environment is, we need to be very aware of what access they have, and the girls and women need to have access to more than one kind of sanitary products for menstrual management. So again, when we're talking about pain management, they need to understand they have pain, access to pain medication if needed, and you cannot blame the girl for getting her period. Now, the only time periods stop when a woman is during her menstruating cycle is when she gets pregnant. Now, the other challenge we have is the pandemic does not stop periods. So the menstrual hygiene has become more of an issue for girls and women during the pandemic, because if they have lost their jobs, they cannot afford to access these sanitary products needed. So how can they maintain menstrual hygiene? So you see, this is such a complex problem. I would not say complex, I would say this is a multifactorial public health challenge which needs to be addressed by all of us at different levels. And now, these are some statistics. As we know, that this is the sad part. 800 million women and girls worldwide menstruate each day. This can be much more, as we know. And also, the sad part is 1/3 of girls in Asia and 1 in 10 girls in Africa miss school because of their period. So it's just not enough for us to make sure they have access to uh, sanitary products, not just 1 month, but excuse me, throughout their life. This needs to be sustainable, and also to make sure they have the necessary water supply, wash facilities to maintain hygiene. Now, again, do you know that this is it? Approximately 3,000 is the number of days a woman spends menstruating in her lifetime. So, and this is something which like really, really important. That means she may have around 450 periods or more during her lifetime. And why should she be shamed because she has her period and denied the access to these products? Now, this is really interesting. As you can see, this is a brief history. That's why I of how the evolution of the menstrual hygiene in the modern age. And if we come down here, you can see that how there were applicators, there were tampons, and then usable commercial menstrual cup was there from 1937. Then we have the adhesive strip pads. And then in 2005, that is just a few years ago, 17 years ago, first formulated use of the term menstrual hygiene management in 2005. This just tells us how long it took for the world to recognize and come up with this term. And also, now there are programs addressing menstrual health. And there is also, as you know, the International Menstruation Hygiene Day. There are several programs. And in 2018, India and South Africa removed the tax on menstrual hygiene products. And even now in the United States, we do have a tax on menstrual hygiene products, which is very sad because women cannot afford it. And those women who are incarcerated and in prisons, there is a terrible short supply of menstrual pads. So what do we do? Now, we all need to be working. Yeah. So one of the most important things is education on menstrual hygiene, and we all need to work together. So I'm sorry, my Mac is acting up. As you can see, these are some photographs courtesy of UNICEF. How now recently there are books which explain girls about what it is to have a period, what do you have. And you can see these women on in the picture, they are building latrines, as they're called, or toilets, which women can use. So this is something which is very important. And now American Medical Women's Association, we are working with Days for Girls, which is an NGO, to, and we have a lot of medical students, public health students, my daughter, her friends, other youth, including young men and boys, working to raise funds to have reusable menstrual products. So this is really important. So there are reusable menstrual products, which their volunteers, they either fundraise or they work with the teams of Days for Girls to sew these menstrual pads. And these are given, a kit is sent to these girls, so that you have these kits which have 4 to 5 reusable pads, some underwear, soap for the girl, and put in a nice cloth bag. Please note, not plastic, being recyclable, focusing on sustainability and to make a healthier excuse me, environment. And these girls have the privacy of keeping their feminine menstrual products in a little bag, so nobody looks at it, there is no embarrassment. So one of the main things is to make available menstrual hygiene products, but make available menstrual hygiene products which can be easily used. And a lot of them, even now, there are some machines which I think have come up in India. I was talking to a colleague who mentioned that they are making pads out of recyclable material which can be used. So this is important. And as I finish up my presentation, I think what can we do? We need to make sure there's social support across the various sectors, and knowledge and skills for not only individuals but all the communities globally. This is just not for Nigeria, Ghana, Kenya, India, or Sri Lanka, or Latin America, but basically across the board. And facilities and services, this needs to be put in the policy. And also we need to make sure there is access to absorbent materials and supportive supplies for the young girls, male involvement, gentlemen, brothers, fathers who are fathers, brothers, partners, husbands, colleagues. Please make sure that you support all the women in the community, because male support is needed to make sure that girls have their periods and don't have to be ashamed, because you are upholding the human rights and dignity. And the other important thing is to remove the tax on menstrual hygiene products. And in the US, a lot of us have even been signing petitions. Hopefully, the tax on this is removed in other countries. And Scotland was one of the first countries where they supply free menstrual pads for girls in schools. So this is really important. And this, I think this is a communal effort, grassroots effort. It has to go across people. And the last slide is, yes, we can. The reason I have this slide here, because the yes, we can is made up of photographs of people. That means all over the world, we can do this by joining together to make sure that there are sustainable menstrual products available, accessible, just not to a girl born into a richer family, but girls across the board. So thank you so much for this. And I turn it back to you, C. Fine.
Thank you so much, Professor Panu. That's a very exciting lecture presentation. We are so grateful. And at this moment, we have to, if you have any question, kindly raise up your hand. And it's an interactive session. The idea of this is for us to share the knowledge to support the girl child in the world, all over the world. You can see the statistics, 1 in 3 in Asia, 1 in 10 in Africa. It is very, very bad. In fact, we have one of our people here who has done a very extensive research on menstrual hygiene management in Africa, especially in Nigeria, in Abia State. After the question and answer, she will present her findings and her knowledge and the way forward. I think this is the moment for us to join this action. We are raising 10 million voices across the world. Gathered here today are people from different countries of the world, working on different areas and supporting these 10 million voices, speaking for free pads, free menstrual hygiene materials to the girl child. It's something great. And we have started it, building the capacity, spreading the knowledge, because when we have the knowledge and it stops on us, it makes no meaning. We have to speak and talk to the people who are not opportune to be in this forum, who are not opportune to be in this platform. There are many girls in the villages, a girl in the Kenya, Zambia, Zimbabwe, Nigeria, Senegal, Mali, Gambia, just mention it. Philippines, they are there, they have no assets to information, what is expected from them. They have no access of what government is supposed to do. So these are our opportunities. Kindly raise your hand. We'll give you the opportunity to talk. George Blamo from New York, you have the floor.
Thank you so much, Dr. Pamini. What an awesome presentation. I'm so grateful. I wish that I had such a knowledge years previously. But my challenge here is that there are mothers, sisters and daughters who are in the village, and some of them practice the traditional hygiene. What are ways we can be able to support them and also integrate some of this teaching that you presented to us? Thank you.
Thank you so much. I really appreciate your question. Thank you very much for, as a man, I think it's very important that you are so aware and want to do something. So I can tell you what we have done in India is because I'm also working, and Sifa and I will share that information later on what is called a Sustainable Menstrual Coalition, which is a group of people come together to address this issue in India. And once this pilot project is launched in India, to bring it to other countries. And, definitely I will talk to you to see how we can work together to bring this there. So that being said, one of the things was we had the people go to the local villages and talk to them. And this is the thing, not say what you're doing is bad, but to say maybe doing this is better. And also one of the things is, I know what Days for Girls has been doing is we reach out to people to make them aware of how can they stitch these menstrual hygiene products from cloth which can be used. And also, so that is something which is being done, and how to make them aware of menstrual hygiene, because as you know, in some societies, the girl is not even allowed to bathe for 5 days when she's having her period. So just to educate them to say, you have these practices, but it might be more advantageous to you, your daughters, the family, the community, by just slowly integrating these. Because one of the things I have found is the way you tell somebody. You don't say, you've given me a glass of water which is half empty. Instead of that, saying, Thank you for giving me a glass of water, which is half full. Is there any way we could add some more water to it? Or is this what you have? Or is this gradually? So any change, as you know, has to be introduced gradually. And one of the things I have found is to work with the local person who is there, the community organizer, or somebody who can give the information. I hope I've answered your question. This is a gradual process, but you know what? Change does not come in a day. And we have to do our best to give them this message that we are here. We need your help to improve what you want to, how better is it for your communities, your families, because we can never say we know everything. I am the great person coming from the city telling you you have to follow. No, none of us like to be made small. None of us like to be insulted. There is a way of talking to people. So especially in public health, the key is communication, which leads to behavioral change and also to practice. I hope I've been able to answer your question. Thank you so much.
That is very profound. Thank you so much. You are muted, sir. You are muted, sir.
Oh, sorry. Let's listen to Dr. Gocho Hajruka. Please, you can ask your questions. One of the powerful activists in menstrual hygiene management. If we can see your video and you see your beautiful face once more. Thank you. Can we see your beautiful face?
Okay. Thank you so much, Dr. Fine, for putting this together. Thank you, Professor Murphy, for this wonderful presentation. You were so magnanimous in touching every aspect of menstrual hygiene management. Menstrual hygiene management is what we have been working on. It was a core project in our organization, HAFI, is what we are passionate about, because we believe when you're having interface with girls, adolescent girls, there's no way it can be complete without discussing their menstrual hygiene needs. It's very important that the word menstrual hygiene has a multi-sectoral approach. If we want to eliminate period poverty, it's not an individual fight. We have to involve government, non-governmental organizations, parastatals, donor agencies. They have to be involved in tackling period poverty for us to achieve equity. It's also very important that we involve key influencers, the girl's mother, we involve the teachers in the school, we involve traditional leaders and religious leaders. It's very paramount that the issue around the stigma and the taboo needs to be addressed. It's not just for us to provide the menstrual hygiene needs for them. We also have to hint on, run aggressive advocacy around dispelling harmful myths and taboos concerning periods. And in the issue of provision of menstrual hygiene solutions, it's also important that we look at sustainability. Yes, I'm so happy that Professor Murthy is discussing reusable sanitary pads, which is what we produce in our organization, and we've distributed over 35,000 pads to young girls and women in Nigeria. And we also empower them with machines so they can make these pads for themselves. Now, my question to Prof is, how do we ensure sustainability? How do we remove monopoly from local organizations so we can have a lot of women who can produce reusable sanitary pads so they can also distribute or even sell them to earn an income from it? Because we are aware that menstrual hygiene is a cross-cutting issue, cuts across SDG 1, no poverty, because you'll be able to provide, or women are able to sell reusable sanitary pads, they'll be able to eliminate poverty in their homes. Girls will be able to stay in school. Women's health will improve. We'll be able to protect our environment. So you can see how it cuts across several SDGs. So how are we able to empower women, young women, small and medium enterprises, so they can make this reusable pads and help other women in the community, and also help their young daughters, because we believe in intergenerational knowledge transfer. If a mother learns, is able to teach her daughter, who goes onward to teach her own daughter. So how can we pass this knowledge from one generation to another, at the same time empowering women and girls with economic skills and talent? Thank you.
Thank you so much. And please accept my congratulations for the work you're doing. That is so amazing. This is the thing, you know, when two hands clap, you get a sound. When 5 fingers and 10 fingers join together, there is strength. So in answer to the question, one of the things I have found is, you know, working with some of the colleagues in India, they to promote the small scale industry, as it's called, or the home-based industry, they form like a cooperative. It is something like a microcredit. So usually there is one person. Can somebody mute themselves, please? It's a little disconcerting. May I ask a person to kindly mute herself or himself? Thank you so much. Thank you. Sifai, can you please mute that person? It's really very noisy. So just to continue, is what they have done is they've formed like a cooperative. They've reached out to the cooperative banks. I don't know if you have them in Nigeria. Seafoy, can you please mute her? Thank you so much. So this is something which I think, so what happens is the women are not in competition with each other. I think that's another important thing. But just to say that, you know, they help them with selling the products and advertising them. And also, I know there has been a movement in India on how for even the available supermarkets to store these products for the women and give them the proceeds from the sale. So I think, as you so well said, this is a community effort. We need to bring in everybody. And this is the whole thing. Sewing the pads, it empowers women. It gives them a sense of, you know, financial independence, which we all need. So it comes back to the principle of microcredit and also building the communities and serving others. So in the picture I had in my slideshow, where I showed you women building bathrooms, and the advantage of this, these women got empowered and they earned money, and they gave back to society because they employed other women to like kind of work with them, clean the toilets, make sure there is running water. So again, this is a team effort and we all need to do it together. So my suggestion is, this is what has worked in some other parts. I'm not aware of Nigeria. Hopefully I can visit your country post-COVID, whenever that is. We don't know, right? See, fine, we can have this conference in person, hopefully a bigger one, public health one. But what I'm trying to say is, this is the thing. And the key to it, I find, is creative, concise communication. So I hope I have answered your question based on my experience and to the best of my ability. And thank you so much for the work, and hope we can all work together to end the stigma associated with a period. It has to stop. Thank you.
Thank you so much for the great answers. Ugochi has done a lot of work in Nigeria, especially providing the free pass and spreading the information. But at the end of the day, Nigeria owes her a lot for bringing this into the front burner. Ugochi, thank you so much, Doctor. More questions or reactions? We also welcome Dr. Mellin. Dr. Mellin from University of California. She's very working on supporting NGOs and civil society organizations. Mellin, can we hear your voice?
Hi. Yes. How are you today?
We are fine. We can see your face too. Okay.
Yes, no, it was a pleasure to join this. I'm Melina Alexanian. I am not a doctor, just to clear up. I work at the University of Southern California at the Center for Emerging Pathogens, and we work with different NGOs across the globe to provide educational content around WASH topics and things like that. So it was a pleasure to join. Thank you for the invitation.
Thank you so much. She is working with many NGOs, especially on the WASH aspect of menstrual hygiene management. Dr. Uchenwamo, can we hear you? Uchenwamo is a specialist consultant public health, has supervised a lot of students who have done a lot of research work on menstrual health management in Nigeria, and they have a lot to tell us.
Okay, thank you, Stefan, and welcome everybody. Please, I'll apologize. My video can't come on because of my environment. But we did a work which I supervised Dr. Obiechina, and she is in the forum. Please, I'll call on her to tell us her findings, where she worked with adolescents in school and out of school adolescents in Umuahia, Abia State. So maybe she could just tell us about her findings when she did the study.
Dr. Obiechina, you can unmute yourself and tell us your findings and the key factors in menstrual hygiene among the adolescents based on your research recently.
Okay. Good evening, everyone. It's good evening here. I'm Dr. Obiechina Ogochukwu from Nigeria. Thank you, Dr. Stefan, for putting this together. I'm so grateful to be in this program. I must thank Professor Pandemic for her lectures. Keep learning every day. So my work, the title of my work is Menstrual Hygiene Practices, a comparative study of in-school and out-of-school adolescent girls in Abia State, Nigeria. Abia State is one of the 36 states in Nigeria, in southeastern part of Nigeria. And the study objective was to assess and compare knowledge, practices of menstrual hygiene, and identify predictors of menstrual hygiene practices of in-school and out-of-school adolescent girls in Abia State, Nigeria. It was a comparative study, cross-sectional study, has a mixed method, so quantitative and qualitative aspect of it, and a total of 2,444 adolescent girls, both in school and out of school girls, participated in this study. So my finding quickly to that, the knowledge of menstruation and menstrual hygiene among the in-school was greater, higher than that of the out of school. And the level was at 45.5% for in-school, but for out of school it was 25.2%. You can see that in both groups, they are below average. The practice of menstrual hygiene for the in-school was 63.9%, while for the out of school was 49.4%. These were assessed using 10-item questions. So a scoring and composite scoring method were used to assess the knowledge of menstruation and menstrual hygiene, as well as the practice of menstrual hygiene. So in my study, I found that the predictors of good menstrual hygiene practices in both in-school and out-of-school adolescent girls were the use of commercially made sanitary pads and access to water and soap. But for the in-school, those that were able to, freely discuss menstruation with people around them, for the out-of-school, mother's educational status, father's educational status, presence of pain during menstruation, regular menstrual flow, and see menstruation as an unclean body process, predicted good menstrual hygiene practices. So from the qualitative aspect, we were able to discuss with these girls on the experiences on menstruation and menstrual hygiene. Most of them have this fear of sudden blood leakage, secrecy, shameful, and stigmatization, as earlier pointed out by the professor. And then loss of concentration in their studies, in their activities, daily activities, and also presence of menstrual pains. So among the challenges they pointed out during the focus group discussions were insufficient knowledge about menstruation and menstrual hygiene, poor access to menstrual absorbents, poor quality and inaccessible toilets, facilities, even inadequate water and bathing facilities. And they also pointed out that there are some things that will help them improve in their menstrual hygiene practices, things like education, making these menstrual absorbents free for them, and then provision of wash facilities, both in their schools and in the communities. So in a brief, that's my findings in the study conducted among these adolescent girls in Abia State. Thank you.
Thank you so much, Dr. Gochukwu Obiechina. You can see what she found in her studies in Abia State is not different from what Professor Padmini has presented to us. The issue of the stigma, the issue of absence of the materials for the menstrual hygiene, and that these girls need support. They've mentioned that they need support. So the idea is that now we have known all these things. How do we help our communities? How do we help the girl child? That's the question. How do we bring this information? It's only through volunteering to work. I always maintain you can only volunteer what you have. When we say volunteer, we don't expect you to take all your money to go and buy sanitary pads for the children. Let us talk about it every day. Let it appear in our social media handle, in our community, in our churches, in the meetings. Let us talk about it. I'll give the floor to Jonan Kiakusi. She has a question to say. Jonan, you have the floor. Oh yes, you can talk.
Thank you so much, dear. Okay, thank you so much, dear team, for this wonderful engagement. And I'm Jonan from Child Rights Development Foundation, a CBU working in Bulisa district in Uganda, and we are equally implementing some activities in regard to menstrual health management. However, I also want to add a little voice on some of the unique challenges that our colleague has just shared on what she got from the research that she conducted, and particularly in regard to our country and specifically in the Bulisa district. We see that sometimes when these little girls begin menstruation, they are easily lured into bad behaviors or early sex in the promise of pads. And even some cultures still have norms and beliefs that when a younger girl starts to menstruate, it already means that that girl is ready for marriage, which is really not right. And as an organization, we are trying to push on very hard to ensure that we try to fight all the myths and misconceptions rotating around menstruation of girls and women. Thank you so much. For the meantime, I just beg to submit that.
Thank you so much, Jonan, from Uganda. Thank you for the work we are doing. Congratulations. What we are trying to do is that all the work we are doing in our different countries, let us find a way we can bring it together, find out what is unique about each country, what can we do to intervene, how do we support each other, how do we engage the donors, the people who can support, even the government. We have to engage and interface with government to know that there should be a budget for the girl child who could not afford the sanitary pad to live her normal life. It is a big challenge, but we can overcome it. We welcome you to join the 10 million voices across the world to keep on talking. It's from our voice, like Professor Padmini said, when you clap with one hand, you hear only one clap. But when you clap with a lot of hands, people clapping together, it will make a big noise. for the world to really understand what we're saying, appreciate the plight of the girl child, and do something about it. More questions? Feel
See,
free.
I would like to say something. I think what you said, I mean, this is really good to have forums like this to talk about it. Maybe you should create a Facebook group, 10 million voices, and like add all the people who were here to that. So there's a great way of interacting. And one of the other things is, one of the things here which is being done in the US is, like, there are some companies who give up, if you buy something, a part of the proceeds go to a charity. I don't know if this is done in Nigeria and other countries, because this is a great way of promoting corporate social responsibilities, and there are so many of these people. And one of the other things I know which is being done, one of my colleagues told me, is a lot of celebrity men are coming out with videos where they are talking to their daughters about period. And just now our colleague from Uganda said that how girls are being lured with the lure of free pads. This is terrible, because this is, again, they're being violated, they're being preyed upon, and they're being taken advantage of. So I think what I think we can do, it's not that we can do it in a day, but definitely is by having a coalition, by talking about it, and making sure we can do something. It's just not money, it's educating people and empowering the communities to come together, as one of our the earliest colleagues who said when she was talking about the efforts of women making pads. So I think this is what we need to do. It needs to be both a bottom-up approach and a top-down approach and a lateral approach. Otherwise, we cannot get to doing what we have to, because I can not imagine even 10 years ago we could have a forum where we are actually discussing the period without whispering about it. So I think this is a little bit of progress, but we need to go and see. Fine, I think it's really great you have done this. I really commend your vision and bringing together everybody. And maybe this is a way of starting a Facebook group or a listserv, where if we have ideas, if something has worked, we share it. Because just by sharing, we are not losing our place in the sun. Actually, the whole thing, you light a lamp for it to spread light. So the same thing we are talking about, this to increase awareness and work together. Thank you so much. I hand the back to you. Thank you very much.
Thank you so much. I want to hear from Eda Gibati from Italy. She's doing a great work in Italy, helping the migrants, a lot of people who are in need in Italy. Eda Gibati, say hi to the platform. And maybe it's not. Suman Barra, can we hear from you? Unmute yourself.
Hello.
Thank you.
Hi.
Yes.
Good evening. Hello.
Yeah, we are hearing
Hello.
you. Continue, we are hearing you.
I'm from Bangladesh. I am International Assistant to the President, Miss Ida Juvarati. It's an Italian organization. People Lipsa Onlos. I am nice to and grateful to everyone. This is a very auspicious program and a lot of educational and motivation speech today. Thank you so much to everyone. Okay, bye-bye. Take care to all.
Thank you so much, Suman and Eda Gubat from Italy. They are doing a great work in Italy and supporting the migrants and people who are stranded in Italy. That's a very great work. Thank you so much. Congratulations, sir. We need more questions and more ideas on how to go about it. You have had Prof suggested we approach big corporate institutions, companies, for their corporate social responsibilities to adopt this our program, so that in their item they might say a percentage of whatever they sell or proceed goes in procuring sanitary pads for the girl child or providing the menstrual management materials. Is a good idea. We have from what our colleague is doing in Uganda, trying to educate the local people about modern management. We have from Dr. Hajruka producing and manufacturing sanitary pads as a way of empowerment to the youth. We need more ideas to move on. We'll go to talk. We are going to form a Facebook group. We'll be on Twitter. Let us share our work. Talk to your immediate community. Take pictures, share the pictures. Make a 1-minute video. If everybody here can make a 1-minute video in support of good menstrual hygiene management and the provision of free sanitary pads, it will make a wave. It will create an impact. Just 1-minute video, we share it around the world. We want to create flyers with our pictures, with our voices, men and women speaking together in one direction. We need more ideas, sirs, and Mars in the house. Funke Awodia is a great poet, and she writes so much. I want her to use the power of writing. As a poet, I will have Funke. Can we hear your voice? Funke Awodia, can you hear your voice? She's doing a powerful work in the western part of Nigeria, has been writing a lot, visiting schools, sharing the program with them. Funke, unmute yourself. Let's hear from you.
Hello?
Hello, Sadiq.
Yeah, can you hear me?
We can hear you very well.
And nice to meet you. Meeting this conference. I'm very appreciate. And all I think, or what I want to add, most of our people that have been said it.
Thank you. Can we hear from Teddy Igori? Teddy is in New York, doing a great work empowering the widows, supporting the girl child too. Teddy, can we hear from you? Oh. Everybody, the floor is open. We need your suggestions. We need your active participation. Sadiq, you are back. Can we hear? Okay, we lost him again. Jonan from Uganda, you want to talk? Unmute yourself.
Okay, thank you so much again. And maybe looking forward on the key suggestions that we can take forward as organizations. I think first and foremost as organizations, we could think of organizing intergender dialogues between men and women, because menstruation is not only a women's issue, but men also need to equally understand what menstruation is, and in case they came across a woman or a girl who is menstruating, how them as men can be able to support such groups of people. Therefore, we need to use men and boys as agents of change. For example, if a girl is at school and maybe it so happens that this girl was not prepared and she begins to menstruate, it would ideally it would not be good, for example, for the boys to start laughing at that particular girl. But if these boys are empowered with the knowledge and skills through the intergender dialogues, it can really do some great piece of work for us. Then we also need to focus on ensuring that we improve on the sanitary facilities in schools, whereby at least there should be constant provision of water and soap to support these little girls in schools. Then also need to empower the girls and the women themselves in regard to handling matters that concern menstruation. Sometimes you find that when a girl starts menstruating, they fear, for example, to inform their parents of what is going on. And as a result, many such girls resort to telling their boyfriends, who in turn buy for them those pads in exchange of sex. And this has greatly affected our little girls. Thank you so much.
Thank you, Jonah from Uganda, for sharing your ideas. We are grateful for that.
Yeah, I have some idea to share. I think I was looking at the statistic of Africa, and I realized that we have about 40% of young people with the age of 15. And I think it is very much expedient that we strike a partnership and be able to work alongside with the Ministry of Education within our various contexts, so that we see how we can be able to shift the curriculum about menstrual hygiene and management. I think if we can uh, start from the top, especially in the educational sector, we will be able to preserve the next generation, and it will create a safe environment.
Wow, that's a fantastic suggestion. I think we have to work with the Minister of Education. From the research done by Obiechina Ogochukwu in Nigeria, you can find out that many of the schoolgirls even have some gaps in the knowledge about menstrual hygiene management. I think it is a way of putting up an action together to make sure that they include it in the school curriculum, and also in our church meetings, there will be mothers need to be educated so that they are the ones that will educate their child about the menstrual hygiene education or management. Beautiful idea. We are compiling together. We are also into the coalition. 10 million voices. I thank you for being part of it. And we'll keep on spreading the message for people to understand how do we support the girl child. Teddy, you want to talk? Who else, so that in the next 10 minutes we'll be rounding up. We'll be sending you the link of the Facebook group, 10 million voices for menstrual hygiene management. We'll be sharing a lot of information there, a lot of links, a lot of contacts, and so that we can build together, see what's happened. And you want to talk? Okay, you can talk.
Hi. Yeah. This is Choma from Nigeria. Okay. Joy. Hello.
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 Yeah, we
Joy
can hear
from
you.
Nigeria. Can you hear me?
Very well. Talk.
Okay. I'm suggesting that the menstrual hygiene management should start from home, especially from mothers. We got to educate the mothers, probably from church or any gathering where mothers gather, to tell them about the ideas of menstrual cycle management, especially the way they will take their younger girls, because they start from the home. We'll tell them and share the ideas with them, especially how they will use water and the age, especially the age they're coming up with. You start the training from home. Then from there, you educate them in the church or wherever they gather, mothers first. Then from there, we take it to maybe Ministry of Education as one of our agents here, bring in the idea so that the schools, especially girls' schools, will be aware of it. Thank you.
Thank you so much. The very nice idea. This was part of the strategy. I
want to talk.
Okay, go ahead.
My name is Freya Drama. The issue in this, thank you for
allowing me to talk. So the issue I want to speak up is to advocate more if there will be any need to help the girl child, like girls in secondary school and in tertiary institution that cannot foot to buy sanitary pads. Is there any way they can be getting it free? Is there any way they can be getting it? They'll be offering them free sanitary pads in order to help them, because I've come across a girl that always uses her wrapper. She cut her wrapper to use it for sanitary, so we use tissues instead of sanitary pad, which is dangerous to their health, which is unhygienic. So is there any way they can get access or advocate for them? They can be getting free sanitary pads, those in the boarding schools and tertiary institutions.
Yeah, thank you so much. That is what we are really trying to work on, trying to raise the advocacy campaign for people to provide sanitary pads. Professor Padmi suggested that if we can tag along with big corporate institutions, if they can use it as their corporate social responsibility, we'll create what we call sanitary pad banks in our various communities. So when we get these donations, we can share from there. But now you find out that it's only not actually possible to provide it all the year round. But by the time we start making the noise, many people will join these voices and start providing these free sanitary pads for the people who cannot afford it. If we can, in our community, we create like a sanitary pad banks or menstrual hygiene material banks. Anyone donated, we can stockpile it there within the churches or within the school premises and share from there. But we are just starting, like Prof. Padini said, everything cannot be achieved in a day, but with time, the awareness, we are discussing about menstruation freely, unlike some years back, you can't even talk about it.
Okay.
Yes.
Thank you very much, sir.
Thank you, welcome. Ogochukwu Bettina, you can talk.
Okay, thank you once again for giving me an opportunity. My suggestion to add to what has been said is that whatever we are doing, let's not think only for maybe girls that have already achieved menarche. Is very important if we capture these girls before menarche occurs, equip them with adequate knowledge, educate them on what to look forward to, so that when they experience these things, they will not have fear, because studies have shown that those that are equipped with knowledge before menarche do have better experience than those that do not have this experience, knowledge before the menarche occurs. So if we are advocating for maybe education, menstrual health education, we should even be going down to primary schools before they achieve this menarche in their life. And also to remember out of school girls, because they are often how would I put it? They are often neglected. Most of the interventions I came across during my study was on in-school girls. And so it would be so nice of us as a voice to also capture these out-of-school groups, so that our intervention will be all encompassing. Thank you.
Thank you so much, Obiechina. Very, very important. Most of these out of school are being neglected. You find them in the streets. Most of them are held up as a domestic workers. Sometimes they cannot really be assessed, but you can assess them through the churches, through some gatherings. Like what we are trying to do, one of the strategies we are trying to do is to encourage everybody, talk to the people around you, go to the schools around you, talk to them, take the pictures so that we can post it in our Facebook group to show people that this is possible, this is what we are doing, that a girl child can get menstrual hygiene materials. Very, very possible. Make a 1-minute video, just a minute video, talk about this campaign. Make a video where you are talking to the school children, talking to the church group, village meeting, community gathering. It will make a lot of sense. Let us start talking. Yes, we can do it together. Don't you think so?
We can.
Yes, we can.
We can. We can.
More suggestions in the next 5 minutes.
We
We'll round
can.
up. Yes, we can. I believe that. More suggestions?
Hello?
Hello?
Yeah, I'm Onyenzo.
Okay.
I want to make some.
Okay, talk, we are hearing. There's some interference.
About this program, and it is very important to so that infections and that can be cut off, and also creating awareness to them so that they can know how to manage themselves whenever such things are coming up. I mean, when one important thing I want to that it is going to, we are going to, we have determined that we are going to go out to we have to get some flyers, that is a kind of pictures that will work so that when we go to give people some flyers that when they go home, I mean the children, the school children, when they go home, they can carry it and they are not going to forget it so suddenly, so that as they grow all the time. I believe that we are going to catch them young and that can inform information to people that are still, let me say, people who are not even menstruating, who are the age of menstruation, so that before they get to it, they're going to, it's not going to be anything to them. Thank you.
Sorry, Fine. I have another meeting at work. I have to leave. Thank you, everybody.
Thank you so much.
Thank you so
4
much.
minutes.
Bye.
So, thank you so much. We are grateful.
Bye. Thank you, everybody. So sorry. It's a working day. Thank you.
Tang you.
Thank you,
Please, for all your messages, look at the chat box. You can send us messages at info@Center for Public Health. We are putting on the chat box for any inquiry, further suggestions. Feel free to send messages. And we also circulate to you as soon as we set up the Facebook group. We have a WhatsApp group. If you're interested, send your number to info@centerforpublichealth.org. We'll add you to the WhatsApp group. And also send us information so we can send you the link to the Facebook group for us to add our members as much as possible to talk about this menstrual hygiene management. Always feel free. I'm putting a WhatsApp number. You can chat for more information and more contacts and link up. I think we're working together. The next 3 minutes, I think, is a nice day. Nigeria now is 6:23 p.m. I don't know the time in Burundi. Claude, what's the time in Burundi? And the time in Uganda. So thank you so much for participating in this forum. I think this is just the beginning. We have launched the 10 million voices for the free sanitary pads for the children. I would thank you so much. I'm so grateful for you to be part of this program.
It's my pleasure. Thank you so much for having me.
Thank you so much.
Thank you so much. Pleasure to serve with you, brother.
George, thank you so much.
Thank you so much.
Mazu, thank you so much.
Thank you so much, sir.
Yeah.
Yeah, thank you so much.
Oh, Jane. My regards to everybody.
Thank you so much.
Thank you.
Thank you so much.
Thank you
Thank you
so
so
much.
much. Thank you so
Welcome.
much.
Thank you.
Thank you. Bashir Adam, I didn't hear from you. Unmute yourself, unmute yourself.
Good afternoon, sir. Let me say good evening, sir.
Good evening.
Sir, I want to remind you about the not taken to the schools, because here we are having problem with some of the schools that if I'm going for the campaign, they used to ask me for the reason. After the reason, they want me to identify myself and the group that I'm working with. So I used to talk to them. But seriously, I'm having problem with means of identification. That's my problem.
Okay, don't worry. I will transmit the letter to you this night. Another document.
Okay, sir.
Okay, thank you so much.
Thank you, sir.
Bashir has been working with internal displaced people in the Northeast. Has been very active despite the hostile nature of the place. We have been reaching out to the school girls and many girls in IDP camp to receive the free sanitary pads. Bashir, I thank you so much for your sacrifice, for all your efforts to reach the people that are very hard to reach. Thank you so much. So we'll call it a day. Thank you so much. I'm going to end the meeting now. Bye to everybody.
Thank you so much.
Yeah, thank you. It's been a very great day.
Bye.
Bye.